Hi, everyone. So welcome to the third and final part of our Women's Health and Fertility series. For those of you who weren't here the last 2 weeks, I want to reintroduce myself. My name is Sonali, and my friend Shaina and I, with the help of Donna and Dr. Lisa from the Diocese of Rockville Center, have created this three-part series with Jamie Hutchinson. Jamie is a fertility care coordinator and restorative reproductive medicine registered nurse at the Gianna Center for Women's Health and Fertility. She promotes fertility and fertility awareness methods for family planning and educates women about their fertility. Today, she will be sharing with us how to chart a woman's cycle and fertility to achieve either pregnancy or to avoid pregnancy without the use of contraception. I hope you find this natural approach to women's health and fertility useful. During the talk, I encourage you to either keep your cameras on or off, and your mics muted. And at the end of the talk, around 7:20ish, we'll have like a Q&A section where you could raise your hand and ask a question or leave it in the chat. Thank you for listening, and I'll pass it on to Jamie.
Thank you. Welcome, everybody. I'm so glad to be a part of the past 2 weeks. And so this is our third and final presentation, but it'll be recorded and shared. If you wanted to look at it again in the future, you're welcome to do that. So like Sonali said, you can leave your screens on or off, but please mute yourself. We'll be recording it, so any of the static in the background we won't be able to hear if you stay on mute, which is great. And then at the end, there'll be plenty of time for question and answer, either in the chat or if you wanted to unmute yourself at that point, feel free and you could ask a question at that point. So fertility awareness-based methods are a large part of what we use at the Gianna Center for tracking for GYN health and also for procreative health, which means avoiding or achieving a pregnancy. So we're going to go into a little bit more detail about the types of methods that we have and how to begin using them. So just a disclaimer, this presentation provides an introduction to the science and methodology of natural or fertility awareness-based methods, which are abbreviated FABM. So if you see that in the presentation slides, that's what that stands for. And their effectiveness for family planning. This information is not designed to train you to use these methods at all. So if you were interested in doing that, then there's information on how to follow up at the end. If you wish to become a user of fertility awareness-based methods, it's recommended that you can contact an FABM provider, educator of your choice. And there are no financial disclosures that I need to tell you about. The seminar agenda tonight for fertility awareness-based methods is to review the basics of the female cycle, the scientific basis and physiology for fertility awareness-based methods, who would use a fertility awareness-based method and why, the benefits of using one, and also how to get started. So our objectives this evening are to define fertility awareness-based methods, describe the types of FABMs available, describe the biomarkers of fertility and how it reflects the internal reproductive physiology, and describe mechanisms of actions for fertility awareness-based method, specifically for family planning. So we as women, we could really consider the menstrual cycle as the fifth vital sign. Many of us are familiar with blood pressure, pulse, respiration, temperature, but the health of our cycles affect our entire bodies as well. We know this often as women, right? Especially if it is right before a period begins and we start to feel some of those PMS symptoms. Some of us feel emotional, mental differences creeping in. Other people have more of a physical effect. Some people have depression, anxiety, the feeling of being overwhelmed, and it can affect our daily life and become debilitating. So Dr. Paul Hillard at the University of Cincinnati College of Medicine said this: "The menstrual cycle is a window into the general health and well-being of a woman, not just a reproductive event. It can indicate the status of bone health, heart disease, and ovarian failure, as well as long-term fertility. Therefore, if a woman is not having regular ovulation and menstruation, it's a sign that something else could be going on. And that's one of the primary focuses that we have at the Gianna Center, is diagnosing what the underlying causes of any menstrual irregularities would be. So today we are going to focus on what is normal in the cycle. So the life cycle of a woman's cycle spans the majority of her life. Many people can be confused about what a menstrual cycle really is, and some people think a cycle is referring only to the period, or the time of bleeding. But the period is just the beginning of a cycle. The menstrual cycle is actually from day one of the period to the day before the next period begins. This is usually a monthly event that occurs for a woman. We'll talk more about why for some women it could be longer and others it could be shorter. The very first period a woman has is called the menarche. Average age for this occurrence in the United States is about 13 years old, but the normal range would be between ages 10 and 15. Sometimes women will ask, if I start my period sooner, will I go into menopause sooner? And that's not necessarily the case at all. It is common for young girls to be irregular. So it can take several years for cycles to become regular after starting the first period. You may have one for a few months and then skip. It's your body's way of organizing and getting itself regulated in these early years. There's nothing we need to do to intervene at this point in a woman's body necessarily. I meet many women in their 20s and 30s who have been taking birth control to regulate their cycles since these early teenage years when it was irregular. So I always want to emphasize that this route is not the only one way to go. Then for menstruation, we as women will typically begin having periods for approximately 35 to 36 years. So if we're going to be doing that for all that time during our life, we should not feel awful when we're going through those cycles, whether it be physical or mental, emotional symptoms that we're having. And of course, some women go through those roller coasters each and every cycle. And then we will get to a time of menopause, which is pausing the menses. It is the cessation of the menses. It usually happens around age 49 to 51, but it's not considered true menopause until a woman doesn't notice her period for 12 months. And I also want to mention the rates of fertility at various ages. Now, I understand we don't always have control over when we get married and when we start to have children, but I encourage you to try to have children sooner than later, because many women, myself included, do not realize that we have our first dip in fertility around the age of 28. Another dip at age 30, and then at 35, there's a major dip. Some of us are familiar that at the age of 35 or beyond, you're considered advanced maternal age. And, you know, it seems unusual to say that about someone who's 35, but we do have that huge dip in fertility. At the Gianna Center, women and couples who come to us with infertility are an average age of 38 years old. So it makes it even more difficult to try to achieve a pregnancy. And then by the age of 40, it's difficult to become pregnant naturally if you've never had a baby before. So we just want to review the physiology of the female cycle. We'll highlight the hormonal changes that happen and the resulting physical effects that can be observed. Before we begin to go through it, let me orient you to this particular image and figure. On the left part of the screen is the menstruation, or the beginning of the cycle, and the right part of the screen is the end of the cycle, or the day before the menses begins again. The top row highlights the hormonal changes that happen through the cycle. And it's interesting because those look like almost like squiggly lines if you were just looking at it. And if you drew your blood every single day and looked at the female hormones, you would notice that there wouldn't be 2 days that are the same in the cycle. And we as women can definitely feel that in our cycle. We have daily shifts in those hormones, whereas men tend to be very, steady and stable. They're like rocks, and we know we can tell that in their lives too. And the bottom row shows the changes that occur during the process of ovulation. So you can see on the left a small egg, and then it develops as you approach ovulation. Ovulation is the rupture of the egg from the follicle, and then the corpus luteum begins to form. So during the follicular phase, FSH, or the follicular stimulating hormone, stimulates the growth and recruitment of ovarian follicles in the ovary. After a few days, usually one, but sometimes more, follicles dominate. The others atrophy and die. The developing follicles secrete estrogen, or estradiol, which initiates the growth of the endometrium and also causes glands in the cervix to produce the fertile type of mucus. And we're going to talk quite a bit about mucus later on. As the estrogen rises before ovulation, the cervical fluid becomes more watery and stretchy and fertile. Women may also notice moist or slippery sensation and observe clear, stretchy fluid similar to raw egg whites. At first, the increase of estrogen causes a suppression in the luteinizing hormone, or LH, but when estrogen reaches a threshold mid-cycle, it causes an LH surge, resulting in ovulation. And if anyone takes an ovulation test kit, this is precisely what it's measuring: the urine metabolites of LH and estrogen in the body. So after ovulation, the luteal phase begins, and the ruptured follicle transforms into the corpus luteum within 24 hours of ovulation, and then it begins to secrete progesterone. The secretion of progesterone maintains the thickened endometrium and allows for implantation of the human embryo at about 7 to 10 days after conception. Progesterone also causes the cervical fluid to become thick, acting like a plug and a barrier to sperm, and women often note a sensation of dryness. And that would conclude the end of the cycle. If your body recognizes that you're not pregnant, then the menses would begin once again. Cervical fluid is a primary biomarker in our fertility. And during the time of ovulation, the cervix will produce a mucus, or a fluid that can be seen externally on the toilet tissue when you're using the bathroom. The cervical fluid is often clear or cloudy, sometimes a foggy type of color, and lubricative, which means when you're wiping, it feels like you need to wipe multiple times, and it's very slippery. Cervical fluid is an observation sign used in all of the evidence-based methods of fertility awareness, which we'll talk about at the end of the presentation. We've known about cervical fluid for a long time, really since the 1950s through the work of Dr. Cohen. He published this first information on cervical mucus as seen in the schematic at the top of the slide. He described mucus in various qualities around ovulation, and one of his most important findings was that sperm survival directly correlated with the quality of mucus. You can see that sperm were able to survive when mucus was thin and stretchy. He called this a biological valve. And that is something we also talk about within Creighton model system in our teaching classes. So the cervical mucus secretion changes throughout a woman's cycle. It begins as thick and then gradually thins as a woman approaches ovulation. It is watery, egg white, and on the right-hand side of the screen, you can see exactly what a woman would observe at the time of ovulations between her thumb and her index finger. Women generally have a vague sense that they have cervical fluid, but oftentimes women will say, until I really started doing the charting and observing documentation, I wasn't exactly sure when it would occur or if there was a pattern to it at all. So it becomes much easier once you start doing the documentation. The cervical mucus is important for 4 reasons. It nourishes the sperm. It assists sperm motility through the reproductive tract. It filters abnormal sperm. It balances out the pH of the vaginal area, allowing for sperm survival. In fact, if a married couple has intercourse on a day of fertility, the sperm can actually, which means that the woman would have cervical mucus, the sperm can actually live within that cervical fluid for 3 to 5 days. And that quality mucus is stretchy and clear and lubricative. If there's not mucus present, sperm will die within hours. We've known for a long time we needed an egg and sperm for conception to take place, but it has only been in the last 40 to 50 years that we have recognized the importance of cervical fluid. So learning how to monitor cervical fluid is a key factor in understanding your cycle. And that's one of the things that a practitioner would help you with when you're learning any of the evidence-based methods. The female menstrual cycle, just to orient you, would start again, day 1 of the cycle would be day 1 of the menses. And from day 1 of the menses until ovulation would be considered the pre-ovulatory phase. And that phase of the cycle varies in length. So it could be considered short, regular, or long, depending on how much time it took you to ovulate that cycle. Once a woman ovulates, the post-ovulatory phase, which is from ovulation to when she starts her period again, is stable in length. And we generally say it should be about 12 to 14 days for each individual woman, but a range would be 10 to 17 days. So regardless of when a woman ovulates in the cycle, that post-ovulatory phase would be stable. It's important to understand that ovulation occurs on only one day in the cycle. Ovulation doesn't occur today and then occur sometime next week. This form of double ovulation is one of the old myths that needs to be dispelled. Women do not ovulate twice in the cycle. Even if you were going to have twins, you'd ovulate within the same 24 hours, those 2 eggs. So as we said, the menstrual cycle begins with the first day of the menstrual bleeding and ends with the last day prior to the next period. And most people are generally aware that the cycle might not be regular. And especially as students and grad students, when you're up a lot and very stressed out, you can see shifts within the cycle as well. But many people wonder what the difference is between short, regular, and long cycles. The difference is generally the length of the pre-ovulatory phase, because that is what is actually variable. A short cycle, if a woman has a short cycle, maybe a whole length of the cycle would be 24 days, means that she's really ovulated around day 10. A regular cycle would be that a woman would ovulate around day 12 to 16. And a long cycle would be I ovulated beyond the day 16 of the month. But just because cycles vary does not mean that they're unhealthy. Tracking your cycles can be used in any reproductive category, including irregular or irregular cycles, and ovulation, breastfeeding, or so on. So the length of the cycle in each phase varies from woman to woman and even from cycle to cycle in the same woman. Although an average menstrual cycle is 28 days, only about 10% of all cycles are actually 28 days long. But we're really still stuck on that being the normal length of time. 24 to 35 days is considered the normal range for the length of a cycle. So in summary, when we're looking at biomarkers of fertility, we do have external signs that take place in every single woman's body that we can learn to observe in a standardized fashion so that we can tell what's going on internally. So during the follicular phase of the cycle, a developing follicle secretes estrogen. This causes the cervix to produce that clear, stretchy, egg white type mucus, and that's a sign of fertility. So I always tell women, many women think, am I getting an infection? Is there something wrong? I'm not sure what this is about. But that's telling you that you are currently in the process of ovulating. So that's a very good thing. And an LH spike causes the follicle to burst and release the ovum. So if a couple was using the Marquette method, they would be able to determine with urine metabolites, with the ovulation test kit, LH and estrogen rise and peak. And then after ovulation, that follicle becomes the corpus luteum. Your body starts to produce progesterone, and the cervical fluid dries up. In fact, if you would do an ovulation test kit at this phase, you would recognize that it was no longer positive, it became negative. And then the corpus luteum atrophies, initiating the next menstrual period. So when we're talking about fertility awareness-based methods in terms of our procreative health, of achieving or avoiding pregnancy, we want to look at the key components to our fertility. Many of us are very aware that sperm and egg are the two most important things, but really the top three, and what is still necessary for fertility, would be cervical fluid. So for sperm, healthy men are almost always fertile. So they could contribute to new life 365 days of the year. Their fertility usually begins around the age of 12 to 14 and then continues, well into their 50s. A man's fertility will span much longer than a woman's fertility, ability to have a child. And then for the egg, healthy women are almost always infertile, which is surprising to a lot of people, myself included, even going through, nursing school and my studies when I was at university. I remember thinking it would be very easy to become pregnant, and that's just not the case. So if you think of it this way, if a woman has regular cycles, say she has about 12 cycles a year, a woman would only be fertile about 70 to 80 days of the year, about 20% of the time. So a couple together are the most times naturally infertile. So a key component to looking at tracking your cycles and your fertility is recognizing exactly when you're fertile during the cycle, which days are fertile, so that a couple could use it for family planning if they needed to, or for a couple who is having difficulty achieving a pregnancy, would know precisely when they are fertile. The cervical fluid assists in conception and is on average 3 to 8 days per cycle. 8 days is about the most you would be able to have and still consider to be fertile. If a woman has 2 days or less, then that can indicate subfertility or infertility. And the follicle, when a woman ovulates, that egg is only going to live 12 to 24 hours. And that's not a lot of time at all. So once a woman ovulates, that egg is only going to live for 12 to 24 hours. So that's why it's so important, the function of the cervical fluid in extending our window of fertility as women. So when a woman is tracking her cycle, we can see right away what's happening on a day-to-day basis. This is an example of a Creighton model system chart. It shows the menstrual period in red, the pre-ovulatory dry days in green, and the flow of mucus with the white stamps. Then the cycle goes back to post-ovulatory again. Tracking can be started at any time as a teenager or as a young adult. It can be used in any reproductive category as well. Married people, of course, can use it to achieve or avoid a pregnancy. They can use it during breastfeeding, postpartum, or perimenopausal phase. And even if a woman is single or not planning to be married, this tracking can also be useful, extremely helpful in monitoring health and empowering the woman. Tracking cycles can be used really in every reproductive category for your whole reproductive life, or your procreative life. And at St. Paul VI Institute, they're even having some women track during pregnancy, which is really neat. Of course, those women are not in cycles, but they're actually currently researching whether or not women have certain observations during pregnancy that could aid in identifying risk factors for preterm labor and infection. And then all of us, whether we're married or not, will end up in menopause, and we don't have to track after that. So no more cycles, no more tracking. So in this slide, the woman's bleeding would be indicated in red. The days where she's not having any bleeding or any mucus would be indicated in the solid green. And then the white stamps would indicate the days that the couple would be fertile in the month. So she could always determine where she's at within the cycle. So reasons to use a fertility awareness-based method. At the Gianna Center, of course, we teach many young girls really right after they start their periods to get a sense of when am I starting my period, or when did I last start my period, to kind of walk with them through that. And then as young adults, improving health and understanding their bodies a little bit more. And then, of course, as people go on and get married, you can use a fertility awareness-based method to achieve a pregnancy, to avoid a pregnancy, delay pregnancy, monitor cycles, treat medical issues, and also for preconception care. So that's one of a very common and popular office visit at the Gianna Center is a preconception. So Dr. Carpentier talks about how when he was a young doctor, they really started focusing on prenatal care. So actually care of the woman and the baby while they were pregnant. And this was like 30 years ago, of course. And now we're thinking about the care of the woman before she even becomes pregnant, really setting the stage so that mom and baby can be as healthy as possible for conception and for a full-term healthy pregnancy, and for to set the baby out in nice and strong. Women who are in any of the reproductive categories can use a fertility awareness-based method. So that would be regular cycles, irregular cycles, and ovulation, meaning I'm not ovulating. Breastfeeding is a very popular time to come and learn how to do the charting. Post-contraceptives are coming off birth control, hormonal birth control, IUD, any of the shots or devices. And we understand that many women are, starting on birth control from a young age to regulate abnormalities within a cycle, including irregularity, heavy bleeding, and painful periods. And so really at the Gianna Center, using restorative reproductive medicine, we walk with couples to come off those contraceptives, and that can be a very vulnerable, scary time because many women wonder what is going to be happening to my cycle when I come off the hormones. But walking with them through that so that we can see what the cycle looks like. And we know that when we come off the birth control pill, the symptoms will still be there because it was truly just suppressing the symptoms. It wasn't curing or getting rid of the root cause, which is our goal. And if a couple was interested in using a natural method to look more closely at their fertility and using it for achieving or avoiding pregnancy, then they should start right away with that as well. That there's no reason to delay. And then perimenopausal is anyone who is age 40 or above, but that phase can actually start around age 37 for some women. The benefits of using a fertility awareness-based method are enormous. Many women, of course, and families are interested in obtaining organic, healthy food. We're looking at avoiding plastics and estrogens in our waters. We want to avoid preservatives and processed foods. And so we really take that over to our women's health and say, what can I do to optimize my health, preserve my fertility, and still reach my goals with my health? So there are no drugs, there's no hormones, there's no devices that you use. You learn to chart your cycles in a standardized fashion and use the observational routine to determine where you're at in your cycle and to track your times of fertility and infertility. It is environmentally friendly. It empowers men and women, and it's also used as a diagnostic tool. Women will bring their charts to their medical consultant the physicians at any of the Gianna Center or nurse practitioner, and they will use the chart as a diagnostic tool to determine further evaluation, treatments, any medication courses that would be required. They did a large study through FACTS that showed up to 60% of patients studied, and this is across the board of reproductive years, were interested in using a natural method to avoid, and up to 50% of patients were interested in using it to achieve a pregnancy. So there is great interest and growing interest in using fertility awareness-based methods. What we encourage all women to do is to use what's called an evidence-based method. And evidence-based means that there's research behind it, there's published research, both on the effectiveness and the standardization of making observations. And there would be about 5 of those that would be options currently available today that we could recommend. So the Billings method, Creighton method, couple to couple, also called symptothermal, and symptohormonal would be Marquette or Fem. So cervical fluid methods would mean that we focus primarily on the observation of cervical fluid to determine fertility. Symptothermal means that that not only cervical fluid, but you'd focus on basal body temperature. And then symptothermal or symptohormonal would be the urinary metabolites, which would be LH, estrogen, or progesterone. So any method, any of the evidence-based methods are wonderful to use. And we generally say that the best method is the one that works for you. So couples can research and look into any of these particular methods. At the Gianna Center, we use the Creighton model system, which is one of the cervical mucus-based methods, because they also train the medical consultants. And so the physicians are trained specifically to read the Creighton model system chart. So they can read other charts of fertility awareness-based methods, but they can use that chart as a diagnostic tool, as I said, and it's a standardized way to evaluate it. So with Creighton model system, you make systematic observation, and the acronym SOFT can be helpful. So you determine sensation, observation, and finger test while you're making observations. There's a standardized recording system, and we call it the vaginal discharge recording system. And there's also a picture dictionary that we use as a tool. And there's individualized instructions. So that could be for your GYN health. Again, we have many women come for painful periods or PMS, and also for your procreative health. With the Gianna Centers, there's also medical and surgical Napro Technology available. Napro Technology stands for Natural Procreative Technology. It's one arm or pillar of an umbrella term, restorative reproductive medicine. So Napro Technology, provided by trained general practitioners, like we have available at all 3 of the Gianna Center, had live birth rates comparable to cohort study to more invasive treatments, including artificial reproductive technology, which would include IVF and IUI. And this is really encouraging to a lot of women who I've met. So about 60% of our patients come to the Gianna Center because they have infertility or subfertility, and they learn to do the tracking so that they can monitor their health and the doctors can evaluate their cycles better. So it can help and aid in couples achieving a pregnancy, even after failed IVF, IUI, and the beauty of it, I'll mention, is that about 40% of patients have unexplained infertility. And so they come to us having had infertility for at least a year in most cases, and 40% of them have unexplained infertility, meaning there's no actual diagnosis yet. After evaluation at one of our centers, there are 60 to 70 diagnoses as to why the couples wouldn't achieve a pregnancy. And on average, our couples receive 4.5 diagnoses as to why they're not conceiving. And that's really enlightening for couples because many couples will tell us, not only do I want to achieve a pregnancy, but I also want to know what the problem is and I want to fix the problem. And so with artificial reproductive technology, oftentimes we're not fixing the problem at all, but just going around what the problem actually is. So using fertility awareness based methods and having fertility focused intercourse can reduce the time to achieve a pregnancy. So some couples with infertility would have a 20 to 40% chance of achieving a pregnancy after infertility, 12 months, just by learning the charting alone. Um, and they did a study that showed 78% of couples would conceive within 3 cycles. 81% of couples would achieve in 6 cycles of fertility focused intercourse. So a couple could also use fertility awareness methods to avoid or delay, postpone pregnancy naturally. And it is effective means to do that. You would track your cycle and you know with precision when you're fertile and when you're not. So we never use the language of taking a risk or taking a chance or any surprises. You would know on a day-to-day basis whether you're fertile or not. And you work with your practitioner to gain confidence. You have fertility care follow-ups. There are 6 follow-ups within the first 4 months of charting so that you can have that accountability and you can ask questions and become much more confident in what you're doing. So with Creighton model system, perfect use to avoid a pregnancy is 99.5% effective. With symptothermal, 99.4 to 99.6. This is in published research. And with the birth control, most of them would say perfect use would be 99.7%. Typical use takes into effect what could be user error or teacher error. So if you look at typical use, birth control would be 92 to 98% effective. And then Creighton model system would be 96.4% effective. Condoms is something like 88 to 92% effective typically. So they are effective in knowing when you're fertile and when you're not. I don't like to compare fertility awareness-based methods to contraception because, as a couple would say who uses this method or is aware of this method in their life, the benefits far outweigh the family planning decisions that you would make. Couples who they've studied this and they found that couples who use fertility awareness based methods actually have a reported greater satisfaction in marital intimacy and less than a 4% chance of divorce over the course of their lifetime. And that's really powerful. I've seen that in the last 16 years of teaching couples from not only in our area, but across our country and really internationally. I've taught plenty of people as well. And it's really a powerful tool to have as part of your marriage if you would like it to be. So the fertility apps, many people will ask about fertility apps, and there are over 100 fertility apps on the market. And women seem to have a lot of choice when they're using a natural system to avoid a pregnancy. But how many of these apps are really following the science that supports the effective use of FABM? So I encourage you, if you're interested, to look up this study that was done through FACS. FACS developed an objective rating system to evaluate fertility apps and their claims on accuracy based on similar criteria developed by family practice management to rate medical apps in general. It includes 10 clearly defined categories weighted based on their level of importance for avoiding pregnancy, including the comparison of the days the app defined as fertile to what the science shows as days of fertility. The majority of fertility apps are neither designed for avoiding pregnancy nor founded on evidence-based methods. And that's actually includes one app called Clue that was recently approved by the FDA as a form of family planning. Generally, what we say is the evidence-based methods do have apps that are associated with them if you just prefer to use something on your phone. And apps can be a good tool to document information and put it on the chart. But the majority of the apps are actually algorithms um, that would predict your fertility for you. And what we learned earlier in the presentation tonight is that those algorithms are really based on women having 28-day cycles and ovulating around day 14, which we know is only true in about 10% of cases. So just like the calendar and rhythm method were not effective to know when you're fertile and when you're not, the apps are basically the same type of thought. So, if a couple was interested in using fertility awareness based methods, we would always encourage to learn from a certified trained practitioner and take the classes. Many classes are available online, of course. And at the Gianna Center, the classes are actually covered through your health insurance. And so we're there Monday through Friday, daytime and evening hours available. And so it's much better to be able to work with an actual practitioner. So the fertility awareness-based methods, we went over a few of the benefits already. But what I'll highlight here is the self-management and decision-making. It truly does empower couples and women through education, and you will become an expert in your own body, and that's really great for women at all reproductive ages. More resources available through FACS, Natural Womanhood, and the International Institute for Restorative Reproductive Medicine. Those are my top three, and their websites are available on the right-hand side of the screen there. So much great information that's available for any topic that you would want to know more about. So you can visit their sites as well. And the Gianna Centers, we have 3 locations which are located within Catholic Health, one in Manhattan, Rockville Center, and then also Long Island. And we do have Spanish-speaking practitioner available if a couple did prefer to learn in that language.